Hello, my name is Dr. Jacqueline Garrett. I am a board-certified dermatologist at Christian Hospital in St. Louis, Missouri. I've been on staff here at Christian for over 21 years. Today, I will introduce you to 3 of my patients who have lesions that are suspicious for skin cancer. Good morning. Fine, welcome back. Today we're going to do that biopsy on your skin because we did a total skin exam on you earlier this week and we noticed a growth that was new to you.
Right.
So I'm going to have you sit right here on the table with your legs that way. All right. So this is an irregular looking lesion that could either be a basal cell skin cancer or a squamous cell skin cancer. Next, I'm going to numb you with lidocaine, so you'll feel a little prick of the needle and then a little stinging sensation. Well, the medicine works quite quickly. Next, what we do is take a scalpel blade and just remove a little sliver of skin. And at this point, you shouldn't feel any pain, but there may be a little bit of pressure that you feel. And what we do is take a sliver of skin. And this is going to be submitted to the lab. And it takes, maybe 72 hours to get the result. There we go. I'm going to put this in the formalin container to submit to the lab. And then we'll stop the bleeding and bandage you. Good morning.
Good morning.
All right, today we're going to do a biopsy of that lesion on your back.
Okay.
So lay on the table, great. All right, pull this out for your legs. When we look at this gentleman's back, we see a pink bump, and he really doesn't have pink bumps like that on the rest of his skin. And so that concerns me when you have something that stands out different from the others. He has a number of freckles which are caused by the sun on his back, so I'm not so concerned that there's a freckle adjacent to it, but it's the fact that this bump is unlike all the others. Now this skin will go into the jar. We'll send that to the pathology lab. We stop the bleeding with a little aluminum chloride. It's chemical cautery. And next he's ready for a bandage. Good morning.
Good morning.
Yeah. Your doctor referred you here because they noticed this unusual growth on your arm. And what we'll be able to do for you today is remove it. It's suspicious for skin cancer. It looks like a non-healing growth. And we will know for sure once we send it to the lab. How long have you had this growth?
About 25, 30 years.
And has it changed lately? Has there been something different about it that makes...
Oh, just started getting a little bit bigger, and then I knocked the top of it off, and then it wouldn't heal.
Okay. How long ago did you knock the top of it off?
2 months.
Okay. So we have a lump that was traumatized 2 months ago, but it's not truly healing. And anytime we have a bump or growth that keeps scabbing and doesn't heal, and you give it an entire month, then that makes it suspicious for a skin cancer. So we will go ahead and take that off for you. And so when I look at this lesion, it has a pearly quality to it, plus there are a lot of fine blood vessels running through it. I'm suspicious that this one is a basal cell skin cancer, which can be very slowly growing. So it could have been there for the 25 years or more that you recall. And when they're traumatized, like you bumped it, it did not heal like you would expect a sore to heal. And here is the piece of skin with the orientation suture. I'm going to submit it to the lab. There we go. Well, let's just see whether we need a suture. Yeah, we'll do some suturing. And one by one, we're going to tie them off. Okay, so that one, let's see. So you have 2 layers of stitches. One that will dissolve, and then a top layer of sutures that we need to remove in about 10 days. We've wrapped this with extra padding to provide pressure, to control any oozing that might happen. We'll see you in 10 days and we'll let you know the results. All right, thanks. Today we examined 3 patients with suspicious lesions. Each one of them had a procedure so that we can know how aggressive we need to be for the next step. You should be wearing sunscreen each and every day, not just on sunny days or during the warm time of the year. The sunscreen should have a broad spectrum coverage. That means it protects against ultraviolet A light and ultraviolet B light. Plus, it should be water resistant. So be sure to check your skin. You're looking for moles that are changing, they're irregular in shape, or have irregular borders or coloration. Plus anything that is new or different, or a sore that does not heal if you give it a 1-month opportunity. So be safe out there. If you see anything suspicious, contact your primary care physician or your dermatologist to have it checked. Thank you.